Alright, let's cut through the confusion about ovarian cancer. There's a lot of information out there, and it can be overwhelming to know what's accurate and what's just a myth. Ovarian cancer is a serious topic, but understanding the facts can help you feel more empowered and less afraid. I know hearing the word cancer is scary, and with all the myths floating around, it's tough to know what's true. Sometimes misinformation can make us even more anxious, or lead us to ignore important warning signs. That's why it's so important to separate fact from fiction. So, I'm here to set the record straight on some of the biggest ovarian cancer myths out there. By the end of this video, you'll be better equipped to spot the truth and take charge of your health. Myth number 1. Only older women get ovarian cancer. This is a common misconception that can be dangerous. Not true. While it's more common in women over 50, ovarian cancer can affect younger women too. In fact, no age group is completely immune. It's important for women of all ages to be aware of the risks and symptoms. In fact, some types are more likely to show up in teens and young adults. For example, germ cell tumors are more common in younger women, while epithelial tumors are more frequent in older women. So, it's never too early to pay attention to your body. No matter your age, being aware of changes and symptoms is key to early detection and better outcomes. Myth number 2. Pap smears detect ovarian cancer. This is one of the most widespread myths, and it can lead to a false sense of security. This one's super common, but it's a myth. Many people think that getting regular pap smears means they're being screened for all gynecological cancers, but that's not the case. Pap smears are great for catching cervical cancer, but they don't screen for ovarian cancer. There's currently no routine screening test for ovarian cancer, which is why knowing the symptoms is so important. Right now, there isn't a simple routine test, so recognizing symptoms like bloating, pelvic pain, or feeling full quickly matters a lot. Keeping track of these symptoms and how long they last can make a real difference. Myth number 3. Ovarian cancer always has obvious symptoms. If only it were that simple. I wish it did. The truth is, symptoms can be really vague at first. Think bloating, stomach pain, or changes in appetite. These are things many of us experience from time to time, which makes it easy to overlook them. It's easy to brush these off as something minor. But if these symptoms are new for you and don't go away, it's worth getting checked out. That's why it's important to listen to your body. If something feels off and sticks around, don't ignore it. Early detection can make a big difference in treatment and outcomes. Myth number 4. If no one in your family had ovarian cancer, you're safe. This is a dangerous assumption. Family history is a risk factor, sure, but the majority of women diagnosed with ovarian cancer have no family history at all. That means anyone can be at risk, regardless of their genetics. Genetics matter, but they're only part of the picture. Lifestyle, environment, and even random chance can play a role. It's important to know your family history, but don't rely on it as your only guide. Let's clear up another one. Birth control causes ovarian cancer. This myth can cause a lot of unnecessary worry. Actually, studies show that long-term use of birth control pills can lower your risk. In fact, using birth control for several years can significantly reduce your chances of developing ovarian cancer. Of course, every medication has pros and cons, so it's always best to talk to your doctor. They can help you weigh the benefits and risks based on your personal health history and needs. So, what can you do? Know your body. Be proactive about your health and don't hesitate to seek help if you notice changes. Pay attention to changes that last more than a couple of weeks. Keeping a health journal or marking symptoms on a calendar can help you spot patterns and provide useful information to your doctor. And don't be afraid to ask your doctor questions, even if they seem small. No concern is too minor when it comes to your health. Open communication can lead to earlier diagnosis and better care. Let's stop the stigma and misinformation. Talking openly about ovarian cancer helps everyone, your friends, your family, and your community. The more we know, the better we can protect ourselves and the people we care about. Knowledge is power, and sharing it can save lives. Stay informed, stay healthy, and thanks for watching. Remember, you're not alone. Together, we can make a difference in the fight against ovarian cancer.